We looked at the different options on the market, and clearly CareInsight was the one that was preferred by the local clinicians as the safest option for sharing data. Where it's worked most effectively is in the after hours medical and injury centre we have locally. And at the moment all of the GPs provide the after hours workforce in that centre, and they're able to look at their colleagues' data for individual patients back in their practices. And the security they get is the awareness that when anyone looks at their data, they are told almost instantaneously who it was and when it was that they were looking at that data. That's given them a lot of confidence to use this product.
I can think of a case where I had a gentleman who was somewhat reluctant to visit doctors, but has a multiple list of chronic conditions, including insulin-dependent diabetes, ankylosing spondylitis, migraines, and he was on a host of medications of which he really wasn't very clear or forthcoming about what they were. It was really critical to my care that I had some understanding of what he was already on. And I accessed CareInsight, which I found very straightforward and easy to do. He was very happy for me to do that, and felt that it was a very good system because he couldn't always remember everything that he was on. He was on so many different medications. It came up straight away, list of everything he was on, confirmed his chronic conditions, and gave me a list of his intolerances and allergies as well, which made a significant difference to the care that I was then able to provide for him. It only takes a moment to get on, and it actually does help to speed the consultation up because you're not trying to work out what it is that the patient's on. It's all there and very clear.
We're able to access a list of current medications and prescriptions and a list of recent and past medical problems on many patients presenting to the emergency department. And this allows us to have more information to make the right decisions about patient management. As an example, we had a patient who presented with a polypharmacy overdose after hours in the emergency department, and the patient was too sedated to give us any information at all. We had no record from previous hospital visits as to what medication that patient was on, and we weren't able to contact their GP or have any knowledge about what their normal pharmacy was. Using CareInsight, we're able to quickly obtain a list of current medications and work out the likely drug that was involved in the overdose. So it made a significant difference to the management of that patient, and there have been numerous other examples as well.
The information that it gives you often, certainly at that time of the day, is you can't obtain it anywhere else, and I would say in a few cases it has kind of revolutionised as a patient's care, and I think it really has helped my practice. I strongly recommend it. I think it's a brilliant system.